So all of you can peep inside the microscope also later, and you can see a large number of sperms are now floundering around. You can see one WBC which is hitting on the tail of the sperm. Can you see a WBC in front of you?
Yes, sir.
And that is probably a PR sperm, one more PR sperm. So rest all are there is a slowly progressive, a confused sperm, and then there are few sperms which are not moving. But how do you count them? For counting them is always a challenge, and you don't know how to do the right accountability. So we use something called sperm counting chamber. They're made in two ways. Either the whole glass slide, on the surface of the glass slide like this, we have got a grid. We've got a grid in which we have got 100 squares. On the glass slide itself, we have got 100 squares. Or we have got a cover slip which has got 100 squares. So we count the number in 100 squares. So suppose 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So it works like this. So we have something like this. There are 100 squares here. We count in any one line. We count like this, or we count like this. The number of sperms in 10 is the count in million per ml. It's a concentration. So very easy method. So whenever we are counting for sperms, but this is only for semen analysis on the wet smear. On the wet smear, you can't do anything more than this. When you are counting and looking at the motility, that's all you can do with this. When you want to do morphology, or you want to do anything which needs more clarity, then we have to go on the slide, which is 3 inches and 1 inch. No, the matter. So this method is very important thing, and for level 2 ART clinic. For level 2 ART clinic, this is mandatory. For level 1, it is not mandatory. It costs somewhere around 30,000 plus GST. That's the pricing of this thing we have. So now we have many options, and they normally try to give you something like a Macklar. Macklar is a very good counting chamber, but costs around 65,000 INR. So don't buy this. It's very expensive, and you tend to break them very frequently. When we work on a sperm counting chamber, we never cross more than 20x magnification. Why? Because the length, in case you look here, I want to show you here, 40x, right? This is 40x. Are you with me or not?
Yes, sir.
At 40x, we are able to see this image, right? Are you with me? In case I want to go to 20x, I get this image. Where will my fine go now?
Towards me.
Away. It's worthwhile. It's worthwhile understanding with the people. As you go to the higher magnification, as you go from we are going to go towards me, because we are moving to a higher. No, sorry. See, whenever you want to go to a higher magnification, then towards us, and when we are going to a lower magnification, it is away from us. So I am coming from higher to low. Correct. 40. Abhi 40 per I am. I come on 40. From 40 I have come to 20, and this is what we are seeing on the screen. Can you see this?
Yes, sir. Yes, sir.
This is what we are getting here. Some of these sperms are moving fast. This is what image we are getting, and we are very happy with this image. So I am at 20x now. So what you need to see here is the height the height of the objective lens from the platform. So till 20x you can use, the height of this glass slide is 1.2 millimeter plus 0.13 micrometer cover slip. So it is how much? Is basically 1.2, 1.3 millimeter plus 0.13 micrometer of cover slip and a 10 micrometer chamber of semen sample. Now let's look at a sperm counting chamber, and here I open one, an Indian brand. This is what Indian macula, 30,000 rupees. Look at that difference of the height. Now we are looking at the height difference of the two things. This is around 1.5. This is around 4 to 5 times, 4 times bigger than this. So it can't fit into this. Now in case I remove my slide from here, it probably won't go and fit into. I'm going to fit it inside. So is it going inside? No. Why is it not going? Because it needs a height. So it is okay in case I go to a lower magnification. I go to, say, in case I go to 4. I go to 4 first. I go to 4. Then there's a chance that I should be able to see it. In case I go to 4, I may be able to see my image, but otherwise I am trying to come to the central grid somewhere. I focus on the central grid. Okay, central grid. I'll try to get some image for you. The light is pretty high. Correct. Okay. Now this grid is okay for me when I am at 4x. I want to bring this thing in the center. So which one should I use, upper or lower? People have become experts, no? That's the beauty of learning. See, there is a very great person by name of Feynman. Have you heard about Feynman? Richard Feynman. I told you about the story, Richard Feynman, or you know yourself. So what is the story of Richard Feynman?
He's a physicist.
He's a physicist, Nobel Prize winner. So what he says that when I teach, I should be able to teach a undergraduate as well as a scientist in same language, with the same understanding. See, people are just doing a super job. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So it is 1 millimeter and 1 millimeter grid. 1 square is 0.1 into 0.1 millimeter. The chamber depth here is 10 micrometer. So at 4x, I'm getting this information for you. So in case I put my sperms, I will see the sperms in 10 squares and get my answer. Are you with me or not?
Yes.
Now I want to go to 10. So I just go around and I go to 10. Abhi kahan jayega? Where will I go?
Towards me.
Towards me. Difficult?
No.
So you are every 10 minutes you are inching towards your 15 lakhs per year plus a doctor employed.